Hi, my name is Melissa. I'm a population health specialist as well as a nurse with the Villages Health. Today we're going to talk about AFib and A-flutter. First, we want to know what is AFib. So AFib stands for atrial fibrillation. It's also sometimes called AF. Atrial fibrillation is a quivering or irregular heartbeat, or sometimes called arrhythmia, that can potentially lead to blood clots, stroke, heart failure, or other heart-related complications. There are at least 2.7 million Americans that are currently living with AFib. Of these, only 33% of patients think atrial fibrillation is a serious condition. This is a scary number because atrial fibrillation can lead to various serious complications. So normally when your heart contracts and relaxes to a regular heartbeat, you have a good rhythm happening. But in atrial fibrillation, the upper chambers of the heart, called the atria, beat irregular. They start to quiver instead of beating effectively to move the blood into the ventricles. So instead of having a nice regular beat pumping back and forth, it's more of a quivering that's happening. So you're not getting the blood moving everywhere you need to as effectively as it should. So we discussed that atrial fibrillation can actually lead to stroke. So this is something that I hope everyone can be aware of. This is fast. These are the things you want to look for if there is a question or a possibility that someone is having stroke-like symptoms. So look at their face. Ask them to smile. Is one side or both sides of their face drooping? Next, you want to ask the person to raise both of their arms straight out in front of them. Does one arm slowly fall back down? Are they having some weakness in one of their arms? Next, we're going to look at the S. Ask the person to repeat a simple sentence. It can be as simple as, the sky is blue. Are they having some difficulty with their speech? Maybe they're slurring their words. Maybe there's just some difficulty, some unusual difficulty when they're trying to talk. Now, if any of these above symptoms, the face drooping, arm weakness, or speech difficulty are occurring, time to call 911. If they're experiencing one or all of those symptoms, you need to call 911 immediately. This could be a life-threatening emergency. So I hope you can remember: fast, face drooping, arm weakness, speech difficulty, time to call. So next we're going to go over who's at risk for atrial fibrillation. So there's a couple different groups of people that are at risk. So this first slide that we're looking at here, so we're looking at age. The number of adults developing AFib increases with age. So AFib in children is pretty rare, but it can and does happen on occasion. So we know with age, that automatically puts you at a higher risk. Now, as much as we'd like to, we can't necessarily stop our age. The second is high blood pressure. So if you have long-standing, uncontrolled high blood pressure, this can also put you at a higher risk for atrial fibrillation, for AFib. The third one down is any underlying heart disease. So if you've had heart disease diagnosed in the past, if you have any valve problems, any trouble with your atrial, your mitral valve, your any of those valves, pulmonary, tricuspid, any heart valves. If you have cardiomyopathy, any acute coronary syndrome, Wolff-Parkinson-White syndrome, and this is something that you would know about. This is something that your doctor could tell you when you've had an EKG in the past if you've had this. Also, if you've had a history of a heart attack, these can automatically put you at a higher risk for developing this arrhythmia called atrial fibrillation. Also, note that atrial fibrillation is the most common complication after heart surgery. Now, the reason for that is if you're having any heart surgery, you're going in and you're messing with the heart. You're either getting maybe a stent done, you're getting a valve replaced, you're getting something done, and it's affecting the heart's normal rhythm, the normal beat. Even if it's a robotic surgery, it could still be affecting the heart's rhythm and then cause a temporary bout of atrial fibrillation. So it is the most common complication after heart surgery. Some people do experience it. So just be aware if you are scheduled for any of these things or you have any of these underlying conditions, you're at a higher risk. So be aware. This may be why your doctor wants to do an EKG maybe once a year. Your cardiologist wants to monitor the rhythm and rate of your heart because you could have some of these factors that put you at a higher risk. Now, the second list here, these are some more people that are at a higher risk for getting that diagnosis or getting atrial fibrillation. So alcohol can actually put you at a higher risk. Binge drinking, which would mean having 5 drinks in 2 hours for men, or 4 drinks in 2 hours for women. So if this is you, this may put you at a higher risk for atrial fibrillation. Even if you have none of these other risk factors, binge drinking in itself can put you at a higher risk. Some of the other things listed here, if you have a family history of atrial fibrillation, you're at a higher risk. There are some hereditary factors that could be in place there. Also, if you have sleep apnea, maybe you've had a sleep study test and they've noted that you stop breathing for X amount of time during your sleep. This puts you at a higher risk for atrial fibrillation as well, because we know all parts of our body need oxygen. So if there's a temporary cutoff of oxygen, then that can affect the rhythm and rate of your heart, therefore leading to bouts of atrial fibrillation. Another group of people that are at a risk are athletes. So younger or older, if you're very athletic, you're at a higher risk for developing atrial fibrillation because your endurance, you may be used to doing a lot of cardio activities. So increasing the heart rate of your heartbeat, I'm sorry. So this puts you at a higher risk as well. There are some other chronic conditions that may be at a higher risk. So if you have thyroid problems, more specifically hyperthyroidism, if you're diabetic, if you have any pulmonary issues like asthma or COPD, this also could put you at a higher risk for developing the arrhythmia called atrial fibrillation, AFib. So there is a specific type of AFib that we hear about often. It's called paroxysmal atrial fibrillation. Paroxysmal fibrillation. This is actually when the heart returns to a normal rhythm on its own or with intervention within 7 days of its starting. So say you went into this atrial fibrillation, the quivering of your heart, and then 7 days later, it's gone. Your heart is back to the normal rhythm and rate. People who have this type of AFib may have a few episodes throughout the year. It can be very sporadic, or they might go in and out of paroxysmal AFib throughout the day. So it could be often, or it could be very random when you have these episodes. The symptoms are very unpredictable, and paroxysmal AFib can and often turn into a permanent form. So you may have a normal rhythm and rate the majority of the time, and you just have a few bouts of the quivering, the fibrillation. But if it continues, it can actually turn into a permanent form of atrial fibrillation that never goes back to a normal rhythm. So at the bottom here, you'll see even if you have no symptoms at all, you are nearly 5 times more likely to have a stroke than someone who doesn't have atrial fibrillation. So if you have paroxysmal AFib, if you've ever been told you have paroxysmal AFib, you go in and out of a normal rhythm, but it usually goes back within a few days, you are automatically at a higher risk for having a stroke. So be aware of this. Be aware of how you are feeling. Are you feeling some palpitations? Are you feeling some fluttering? If you've never talked to your doctor about this, it's very important to let them know the symptoms that you're experiencing so they can do some do a complete evaluation to see exactly what's going on, because you want to know if you do have this arrhythmia so it can be monitored closely. There are some other types of AFib we have listed here. So the top one, persistent AFib. This is an irregular rhythm that lasts longer than 7 days. So the previous slide, we talked about paroxysmal AFib that usually lasts less than 7 days, but persistent is more than that 7 days. It's longer than a week. This type of AFib will not return to a normal rhythm on its own. And this does require some type of treatment or intervention to help the heart get back into that normal sinus rhythm that we need. The next one down is long-standing AFib. This is when the heart is consistently in an irregular rhythm and it lasts longer than a year. It lasts longer than 12 months. And then the next one down is permanent AFib. This is when the condition is indefinite. Maybe the patient and doctor have decided not to continue any further attempts to get it back to the normal rhythm. So this one is something, maybe it started with paroxysmal AFib. They did some intervention, getting it back into the normal sinus rhythm, and it just continues to go back into the quivering state, the AFib. And after all of these attempts to try to get the heart into the good rhythm, it's not working anymore. So there will be no other attempts. You will just live with this quivering, this arrhythmia. Permanent AFib is usually indefinite. This is what you're going to live with. And then the bottom one here, non-valvular AFib, is atrial fibrillation not caused by a heart valve issue. Now, this one is not necessarily as common as the other ones we have listed here. The paroxysmal is the most common that we do generally see, but you can have any of these different types. These are all types of AFib, all types of heart arrhythmias. You can see the top three on this slide. I mean, these can be some chronic conditions. The top one, the persistent, is more than 7 days. Long-standing is more than a year. And then permanent, that's indefinite. These are some arrhythmias that you could potentially live with for the rest of your life if the attempts to get into a normal rhythm and do some intervention don't work. So some of the symptoms that you may experience with AFib, the most common symptom is quivering or fluttering heartbeat. So if you've ever, for example, gone on a roller coaster or been somewhere where you got scared, you felt a scared feeling, and you feel that where your heart's skipping a beat, it scares you, so you jump. So that quivering, that fluttering feeling that you feel, it would be constant. So you would just always feel that quivering, like your heart inside is just quivering or shaking or fluttering, like you feel butterflies. That is the most common symptom that we do hear of atrial fibrillation. Some other symptoms that people have noted that they experience, they may have some general fatigue feeling, may have a rapid and irregular heartbeat, also a thumping in the chest. That's one term that we've heard on occasion. So you may experience the butterflies, the fluttering, or some people describe it better as a thumping feeling. You may experience some unusual dizziness, shortness of breath, or anxiety, even some overall weakness because your heart is not able to contract and beat like normal with the normal rhythm. So you're feeling overall fatigued, overall weak because you're not getting that blood flow squeezed and pumped where it needs to go. Some people also experience some faintness or unusual confusion, fatigue when exercising, sweating, or even chest pain or pressure. Now, with the chest pain or pressure, if you do experience any tightness, heaviness, pressure, or pain in your chest, you may be having a heart attack. These are the common symptoms of a heart attack. So for this, you would definitely need to call or have someone call 911 for you, so you could be evaluated, because although you may be having some of the symptoms of AFib, you may be having that quivering or fluttering heartbeat, you may also be experiencing other conditions, potentially a heart attack. So tightness, heaviness, or pressure in the chest, that's not something that you want to wait for. You need to call and let them do an evaluation and see exactly what's causing that, see what's going on. So some of the treatments that we talked about, like with the paroxysmal AFib, that's the one that is temporary, usually less than 7 days, comes and goes. Or even some of the others, the persistent, the long-standing. These are some that may require some treatment or intervention. So the severity and the length of the AFib will determine the best treatment. So you need to know your goals. You need to know, okay, if I have this diagnosis, if I have paroxysmal AFib, what do I need to do? What do I need to know about it? You need to talk to your doctor about the treatment options, and then know if you do experience these symptoms, what's your next step? What do you need to do? Some of the treatment options could be medications, could also be some non-surgical procedures, or some surgical intervention. So first we'll talk about medications. Medications are usually prescribed to prevent or treat blood clots, which can lead to a stroke. Also, medications may be prescribed to control the heart rate and rhythm in the person that has AFib. These medications can be used in conjunction with other treatments, depending on what's going on with each individual. The heart rhythm is a little bit more difficult to control. So again, if you are experiencing any of those symptoms and you've never been diagnosed because maybe you related it to something else, you definitely should talk to your doctor about it, because if this is AFib, they need to know so they can determine what intervention, what treatment would be best for you to hopefully get your heart rhythm and rate in a normal sinus rhythm. Note on the bottom here, the longer you have untreated AFib, the less likely it is that a normal rhythm can be reestablished. So if you put it off and don't ever tell your doctor about it, the harder it will be to convert you back from an arrhythmia into a normal sinus rhythm. And sometimes it's not able to be done if it's left over long periods of time. So some of the drugs that can be given, some of the medications that can be given, like blood thinners, again, we said these are to prevent blood clot formation or to treat an existing blood clot. So probably the most common medication that we hear about is warfarin or Coumadin. Now, this is a medication referred to as a blood thinner because it keeps the blood at a good consistency to prevent any blood clots from forming. With warfarin or Coumadin, this is where you would be required to get a PT-INR, a little finger stick, so they can check the blood and check the viscosity of the blood to make sure that you're within the range that your doctor wants you to be, because we don't want your blood to get too thick, because then it could lead to blood clots to form. And we also don't want your blood to get too thin, because then if you bump against the corner of a table, you may have difficulty getting your cut to stop bleeding. You'll also notice with these blood thinners, all of these blood thinners, you will bleed or bruise a lot easier. So be very careful if you're taking any of these, and try to be more aware. If you are working in the yard, maybe wear long sleeves so you don't get little cuts and scratches on you. And if you do bump into something, just be aware you probably will get a bruise from that. Some of the other medications are listed here, and aspirin is at the bottom. That's in rare cases, maybe when Coumadin or some of the other medications are not indicated. It may be prescribed, it may be given for AFib, but generally the others here, the Coumadin, warfarin, are the first go-to. Now, with the medications, there are some possible side effects. With any medication, there are side effects. Some people experience them, some people don't. But you should always be aware of the possibility. So if something does occur, you know that, okay, this may be from the new medication. I need to get a hold of my doctor to let them know. So with the antiplatelet medications, such as aspirin, these can increase your risk of bleeding, like we just talked about. So even though you can get aspirin over the counter, it's not necessarily a prescription, it's important that you do not take more than the dose that your doctor recommended. If your doctor recommended that you take 181 milligram aspirin, that's a baby aspirin, then don't get a 325 milligram and take that instead. So if they're suggesting 181 milligram, you should take 181 milligram aspirin. That's it. Just follow the instruction, because this is what's been determined to be the best treatment for your issues. The one over on the right side, anticoagulants, these increase your risk of bleeding also. So this is the Coumadin, the warfarin, the ones that we had on the previous slide. So if you're prescribed this medication, there's a monthly blood test. It's a little finger stick. This is absolutely necessary to monitor and make sure that you're on the correct dosage. So say you come in and get your PT-INR, it's prothrombin. PT stands for prothrombin. So again, checking the viscosity of your blood. If your level is not within your range, you may get a dosage change. So they may have you take an extra half of a pill 3 days a week, or they might have you skip 3 days a week with no pill, depending if your blood is too thick or too thin. The dosage may be adjusted determining where your levels are. So this week you might be every day, you might be taking a pill 7 days a week, and next week you might only be taking it 3 days. So these blood tests are very, very important. I will also add in here that when someone is first prescribed Coumadin or warfarin, you're probably going to be coming in once or twice a week until your levels are your goal levels are maintained for about a month. So it might take some adjusting, it might take some time to get your optimal dosing correct, but it will get there. So just be patient, because again, you want your blood just in that perfect viscosity. You don't want it too thick, you don't want it too thin. You want it right in the middle where it needs to be, because this is going to reduce your risk of blood clots or stroke. So just be patient. It does take some time at first, but you will reach your optimal levels. So just be aware of that. So next we're going to talk about some non-surgical procedures for AFib. So the first one on here is an electrical cardioversion. This is when they reset your rhythm of your heart. The second one is a radiofrequency ablation, or also called a catheter ablation. So we're going to go over these in a little bit more detail, and I'll explain what they are and what they do. So the first one here is the cardioversion. This is a procedure when the patient would get an electrical shock on the outside of the chest while under some very mild anesthesia. Now you can see in the picture here, they have a little, looks like a little pad on the chest. So this is, nothing is going inside of you. They may give you an IV for the anesthesia, but there's no internal surgical procedure happening with the cardioversion. So you might, they might use the paddles or the patches, but they will shock your heart to try to reset it and get it back into a normal rhythm. This procedure is similar to defibrillation, but this one uses very low levels of electricity. So if you can look at the pictures on the far left, the top picture, this is what AFib can look like. So if you see the peaks of the heart rhythm, right below that, the little jagged lines, it looks like an alligator's teeth. That's what AFib is. That's the quivering that you experience when you have atrial fibrillation. So after the cardioversion, hopefully the end goal would be to get your heart into a normal rhythm. So you can see the difference. This is a normal sinus rhythm, normal heart rhythm on the bottom picture. So that's what we want to achieve with this procedure. So the cardioversion machine is there on the right where the doctor's standing. The patient's laying on the bed with the pad on their chest. They do the shock, and ideally it would convert your heart rhythm back to normal sinus rhythm. So this is one procedure that can be done with just some mild anesthesia. The next one is radiofrequency ablation. So an ablation is used for arrhythmias after long-term medications or cardioversions are either not preferred for that specific patient, or maybe the medications and cardioversions have been tested, they've been tried out by the patient, but they didn't work. So before ablation, there will be some electrical mapping of the heart performed. So they're going to get the mapping of the heart first before any ablation is done. So during the procedure, an electrically sensitive catheter is used to map out the heart muscles and the origins of the extra electrical activity. So the map is going to try to figure out exactly where these quivering, these extra beats are coming from. They're going to try to figure out where the fluttering is coming from. So once they do the mapping, then the doctor knows which areas are creating the problematic electrical signals, those flutterings that you're having, that are interfering with your normal rhythm. So they need to map it out to see where the problem is so they can fix that actual issue. Now, this is another procedure that can be done. It's called a Watchman procedure. This is for patients with AFib who cannot be treated with blood thinners because they may have some bleeding concerns. They may be a candidate for this procedure. So you can see the Watchman device here in the hand. If you want to click the link here at the bottom of the picture, it'll show you exactly how this procedure is done. So if you're interested, it's short video. Other surgical procedures that could be done, a pacemaker may be suggested for the treatment. So a pacemaker is a small electrical device that's actually implanted in the body with wires going into the heart to help regulate the beat. If you have a small computer mouse, nowadays the pacemakers are about half that size. You may be able to see it if you lay flat on your back and you're laying flat, you may be able to see the device. But pacemakers are very small these days. They used to be a lot bigger, but they're pretty small. Another surgical procedure is a open heart maze procedure. This is where a surgeon creates a small cut in the upper part of the heart. The cuts are actually stitched together. The scarred tissue forms, and then hopefully the scarred tissue would restore the heart's rhythm back to normal sinus rhythm. So this is it's called open heart maze. So the surgeon would make some cuts, then stitch the cuts back together, and then in hopes that the scar tissue, where it's growing back together, would then form to make your heart get back from the AFib into a normal sinus rhythm. All right, so that is atrial fibrillation in a nutshell. Next, we're going to talk about atrial flutter. So some people may or may not have ever heard of this term, but we'll go into it in detail a bit more so you can actually know what it means. So this occurs when rapid firing electrical signals cause the muscles in your heart's upper chambers, which are called the atria. It causes them to contract quickly. This will lead to a steady but overly fast heartbeat. So someone with AFib can also have atrial flutter. But it's also possible to have atrial flutter without any other arrhythmia. So you can have AFib and A-flutter, but you can also just have A-flutter. So it again, case by case, person by person. Some of the symptoms of atrial flutter, it very similar to AFib. So you might feel the heart palpitations, the fast heartbeat, the fluttering in your chest. Also maybe some fast or a steady pulse, chest pain, and again, that tightness, heaviness, or pressure, that could potentially be symptoms of a heart attack. So that is not something to just wait. That's something that you should be calling 911 for, to let them know what's going on so they can do an evaluation and see what is causing the symptom. Some other symptoms of atrial flutter could be some unusual shortness of breath, dizziness, lightheadedness, fainting, the heart palpitations, or an irregular rhythm combined with AFib. So very similar if you think back to where we were talking about atrial fibrillation. These are very similar. There are some people that are at a higher risk for developing atrial flutter. Again, very similar to the previous slide where we talked about AFib. So if you have had some of these other conditions, or if you currently have heart failure, if you've had a heart attack in the past, if you've had open heart surgery or coronary bypass surgery, other recent surgery, not necessarily heart related. If you have any heart valve abnormalities or any congenital defects, high blood pressure, AFib, any thyroid dysfunction, here's that alcoholism again, especially the binge drinkers, any chronic lung diseases, so asthma, COPD, things like that. Also diabetes or any other serious illnesses. All of these different things here can put you at a higher risk for developing atrial flutter. So be aware of the symptoms that you're experiencing. If you have any of these other conditions, you definitely should be contacting your healthcare provider so they can do some testing to see exactly what's going on. So we talked about AFib, we talked about A-flutter. Both of these are serious conditions and should be evaluated by a medical professional to determine what exactly it is that you're experiencing and also what is the best treatment. For more in-depth details on blood thinners, we will be having a seminar coming up. So stay tuned to our Learning Center, and we will have that coming up in the next few months. So to reduce your risk, make sure you follow some regular physical activity routines, trying to include some activity every day if possible. You want to get at least 150 minutes a week, as long as you are checking in with your healthcare provider to make sure that you're able to do these activities. Also important to follow a heart-healthy diet. So lots of fruits, veggies, and whole grains we know are very good for our heart. If you do have high blood pressure or borderline blood pressure, make sure you keep a close eye on that. If it does start to climb up, talk to your doctor so they can determine what the appropriate and best treatment would be for you to get your blood pressure numbers back down to the recommended range. You want to avoid any excessive amounts of alcohol and caffeine, because we do know that they can have negative effects on our heart, as well as smoking. So if you do smoke, quitting is going to be your best bet, because that will reduce your risk of any heart disease, as well as other conditions that can affect your body. Now, same thing with high cholesterol. If you have high cholesterol or borderline cholesterol, make sure you continue to follow up with your doctor so they can determine what would be the best treatment to manage those numbers and get your numbers back down to a healthy range. And lastly here, maintain a healthy weight. So all of the other things listed here combined will help you keep your weight within a normal range. So try to keep a close eye on that, because even gaining 10 pounds, if you're now in a higher range of a BMI, so you're in a healthy range, then you gain 10 pounds, now you could be considered overweight or obese. So it's important for you to monitor your weight, make sure you're following a good diet, doing your exercises, manage any high blood pressure, high cholesterol, Try to avoid alcohol, caffeine, and quit smoking. All of these things combined can reduce your risk of developing atrial fibrillation or atrial flutter. If you have been diagnosed with AFib or A-flutter, please take the medications as they are prescribed for you and make sure you get proper treatment and management of your condition so you can reduce the risk of the harmful consequences. These are both very serious conditions. I hope you have enjoyed the presentation. These are some of the resources that we use for the presentation. There's some links listed here if you do want to read some more about. You can click on the blue hyperlinks to take you to the other pages. Now, if you have enjoyed this presentation, you can use your cell phone, get the camera out, point your camera on this QR code, and it should bring up a link. And you can do a quick survey on our presentation and give us your feedback. We do appreciate your feedback. Hope you have a great day. If you have any questions, please feel free to contact our Learning Center, 352-674-1779. Take care. Bye-bye.